Sorry. The Senator from Oregon.
Mr. President, I come to the floor today to discuss several recent floor developments. Yesterday, Senate Republicans started talking about big insurance companies and women's health care. Now, I've heard a lot of talk from Republicans about how the Affordable Care Act is just a big giveaway to insurance companies. I'd ask any Republican who accuses Democrats of bailing out insurance companies to talk to a small business owner in their state who fears that if they don't have the tax credit next year, I repeat, next year, those small businesses won't be able to keep their doors open, run their business, pay their employees, and pay for health care. Now, if Republicans are serious about cracking down on price gouging by insurance companies and executives who want a big payday, I welcome them to the fight. I have been at it for years. I wrote the first tough law. It was bipartisan, that's on the books, to stop the rip-offs of older people who had 10 or 15 insurance policies that weren't worth the paper they're written on. But I can say that since a handful of Republicans joined me in 2008 to crack down on the abuses of insurance companies, Republicans willing to go after big insurance have been mighty few and very far between. So let me repeat, I'll work with any Republican that wants to go after profit-hungry crooks and get them out of the insurance business where they're jacking up costs and denying care. But it shouldn't come, and I say this to my colleagues, it shouldn't come at the cost of kicking millions out of their health care in January. Democrats want to bring down costs for families. It's that simple. So I'm not a sympathizer with the United Health Group. I'm here on behalf of Carla and Bartley of Eugene, who are looking, I say to my colleague in the chair, they're looking at a 500% increase in their premium this year. Now, Republicans say they might vote to lower Americans' health care costs, but only if we agree, in addition, to a backdoor national abortion ban. Mr. President, as always, Republicans are spinning a tale that the government is funding abortion. It isn't. Here's the reality. The Affordable Care Act already prohibits the use of taxpayer dollars for this care. 0 federal dollars pay for this care in ACA plans. What Republicans are talking about putting on the table amounts to nothing short of a backdoor national abortion ban. Instead of working with Democrats to fix the health care crisis they created, Republicans now want to hold women's health care hostage and force a radical agenda on the American people. So I have one thing to say about that, not on my watch. Under this plan, Republicans could weaponize federal funding for any organization that does anything related to women's reproductive health care. They could also weaponize the tax code by revoking nonprofit status for these organizations. Republicans have already demonstrated that they're willing to weaponize the law to deny women basic health care. Donald Trump defunded Planned Parenthood in his horrible budget bill. So the possibilities here are endless, but the results are the same. A complete and total restriction on abortion, courtesy of Republican senators. They've been laying the groundwork for decades, and now they're pulling out all the stops to do it. The budget chair is already talking about another reconciliation bill in this session, so this is a real and present danger. Donald Trump, on the other hand, said he'd leave abortion care up to the states. Well, this latest scheme makes it pretty clear. A de facto nationwide abortion plan has been his plan all along. Since Roe was overturned, women are being denied life-saving medical care. Doctors are fleeing states where they fear persecution. Democrats were told for years by Republicans that they were blowing these scenarios way out of proportion. We were told again and again we were fear-mongering. Instead, now it's all coming true. Democrats must dismiss this radical Trojan horse against women's essential health care out of hand, and the time to do it is now.